I guess it's easy to remember to have blocker down for both. What we used to do, and some hospitals did, was we'd have like down for internal and up for external rotation. So we knew which one was which, but I know you're like, why does she make you do the blocker stuff? We don't even have blockers anymore. But you never know. I mean, the film is still on the registry. When they don't have film and cassettes anymore, we'll stop teaching it.
Internal when it's closed, right? Transparency. Open when it's open.
Okay, so non-trauma, that means he's had pain for a while, not a specific injury. So where does the book say we're supposed to center for the shoulder? An inch below the coracoid, right? You can see the coracoid right below the clavicle. But I think it's easier just to palpate for the clavicle because I don't think you can palpate for the coracoid anyway. So if I would center where the book says, first I'm going to move him over. So move towards your, yeah, right. So I want to make sure that the light is at the MSP because I want to include the head of the clavicle here, the articulation. So the light should be just a little bit past his MSP. See that? And then I still have plenty of room over here for his humerus. Okay, top to bottom, and if I centered right at the coracoid where the book suggests, look what happens. See how you have all this extra light, which is going to cause primary radiation and too much scatter on your image. So if you go 2 inches below, here's the clavicle. I'm putting my 3 fingers like the 2-inch technique. See how that's a better collimation? And then my marker. Erica? Marker? Okay.
I'm over here in my own little world.
I know. I'm squeezing. So go there. Now what do I need to do? Got the shielding. I'm going to push it out so you can see that. Well, so
the arm?
Yes, the arm. If we're going to do external rotation, what do I have to have him do? Palm up. So rotate his hand out. So do it on yourself. Hold your humerus and then rotate your arm all the way out. Can you see how you can feel?
Yeah.
What is that you're feeling in the profile?
Tubercle.
Yeah, greater tubercle. Okay, so what happens when you turn your hands so the back of the hands against your hips?
Lesser
tubercle. You can feel that the greater's moving in. Okay, so you go externally, internally, and the neutral is hanging by the side or resting here, depending on the patient's condition. So if you have the greater tubercle and profile on the external, and I can't really rotate this because it's screwed down. A lesser tubercle on the internal, then when you're doing the neutral, it kind of ends up in the middle here. You can't really see either one in profile. Okay? And so that's all there is to that. You tell them stop breathing. Come in, change your cassette out, go back, take your second exposure, turn the hand out. So the body position is the same for both. Questions?
How much do you want to collimate to children?
I don't collimate much on a 10 by 12 because I want to include the articulation here and here. If he was real small, I might collimate in a little bit side to side here. But remember, as you start to collimate in, if you clip the head of the clavicle or the SC joint, then you're going to have possibly a repeat. Don't do what the book does. The book shows you like this. Most hospitals want you to include the clavicle and the inferior border here of the scapula. Okay? Okay, so for the gray sheet, what do I have to do now? Yeah, you rotate 45 degrees. And if you haven't got the perspective yet of what 45 is, did you see me do that already?
Erica showed me.
Doing your thunder. Okay, so, and you can even look at the hospital has the floor tile, so this is AP and this is lateral, so halfway is 45, right? So, the thing you want to remember, though, is don't put just the feet like that. You have to look at the whole body as a one part and turn the whole body. Okay? So I'm going to rotate him towards me 45 degrees. Another thing you can look at is if you imagine a line drawn between the shoulders here, so this is a plane here, and this is a plane here. If you took a measurement, that would be 45 degrees. Okay? All right, now, because I'm just doing the glenoid fossa, I'm going to collimate down, probably more closer. If I was doing it in film, I would use a 10 by 12, 8 by 10, I mean. But you don't have 8 by 10s in the hospital anymore, so you just have to collimate down to about 6 by 6. Okay, so where do I center for this? Well, it's at the, we're trying to look at the glenoid fossa. So if I center at the glenoid fossa, look what happens when he turns.
It moves.
Yeah, it moves. So I
To the
want
back.
to compensate by centering just to the medial side of the glenoid fossa. You can feel the head of the humerus here. And then right inside there's a divot. You can feel it on yourself, right, where the arm articulates. So you're going to center right to that divot, which is, when I was doing Erica, was right in her bra strap. I know you guys don't wear bras, but if you imagine if you had a bra, and we should have everybody put a bra on so they can
Right, where their wife beaters go.
Yeah, that's true. The take-off strap will be there too. Okay, so he may want to have his arm rested like he's showing because it's injured. But if possible, if they're able to abduct their arm away from the body, where'd the IV poles go? I guess they're outside. There's one over here. Oh.
Ooh.
What you do is just have him hold on to the bar. And if you're, because this is even hard for me, but if I rest, then it doesn't hurt. But me trying to hold my arm like this causes a lot of pain in whatever that is I have in my shoulder. Okay, so you want to make sure that you stay centered here, collimate nice and tight, and just suspend respiration. So I'm going to pull his shirt so you can see where actually his armpit is. See that? Would you just take your shirt off? No, I'm just kidding. But for ribs, I may. Or at least wear tank tops for ribs so they can really get the full effect, okay?
All right.
He's all shy now.
It's done.
This is done.
Okay, let me read what it is. All right. What I wanted to show you before I go to the next one is I'm going to show you some stuff with the skeleton here. I've used this a lot in this section because it's what we call shadow teaching, so you can get an idea of, how the X-ray would look.
Oh, shadow boxing.
Okay, so here you see the shoulder. I've got the light open so you can see the anatomy. And here would be in the AP position, right? And here's the joint space here. So look what happens as you rotate them 45 degrees. See how we're starting to see through the space here, the glenoid fossa? And then when you bring the arm abducted out, see how you can see through the space right here?
Yeah.
So that's the whole point. Now I realize there's a metal bar here, but see how we're seeing the round space right here? Where when they're in the AP, that space is closed. Well, in a real case it is. I got his arm all in the office now. There we go.
So we can do it either way, either like this or like this?
Yeah.
Or you gotta tell us?
But I'm telling you that in clinical practice, if the patient can tolerate it, my experience is I've done monitoring because it was required to do where I work. Abducting the arm out really helps to open up that joint space. Because sometimes you have to go back and the 45 doesn't work, so you try it deeper and then that doesn't work, and then you try it, you end up having to take 3 or 4 exposures. I knew that was right. Okay, now I'm going to show you the transthoracic lateral. Sorry, I have like major coffee.
Tape record you, and then you could play it, and me and Josh can do the
I know.
Then you don't have to
That's
talk
what we
all
should
the
do. We'll
time.
videotape the first one, and I'll just go sit back in my office. We'll podcast it or whatever that means. Whatever.
That'd be so
By the
good.
way, I got an email from somebody that said he's put some kind of mentoring thing for X-ray students on Facebook. I have no idea what that means, but if I forward the information to you, you guys can figure it out.
I have a friend to ask all questions to.
I don't know. Is that what it is?
Upload all the videos.
I don't have time for that kind of stuff. So if you send me like a thing to add me to your Facebook, I'll probably ignore it because I don't know what it is and I don't have time for it anyway. Okay, so turn.
MySpace junk.
Turn to facing. So what I want to show you, move to your right, is we want to find the neck of the humerus. And where do we find it?
Base the deltoid.
Right at the bottom of the deltoid here. So you can kind of feel like this divot. So you want to locate that area, and that's how we're going to find where we're going to center the top to bottom central ray. Okay? So see how this line is bisecting through this. Here's the deltoid. You can feel the lump and then the divot right there. Okay, so now I know I've got my level right. So I'm going to have them turn and face me.
Is that landscape or portrait?
I've just got the light open. I don't have any collimation right now. Okay, it's
the
going to be
cassette would be
landscape.
You don't have
I'll collimate down when I'm done.
one.
We want to keep it lengthwise because if you look at the part is lengthwise. So you always put the cassette the direction of the part. Even though we're only going to be looking at this much, we always put the cassette lengthwise. Okay? Or what do you call that?
Portrait.
Portrait, yeah. I'm not used to those computer terms. I'm old.
Can I get added to my Facebook? Oh yeah, that's right. I didn't even think about
Okay, so my point was now we've got the top and bottom level, and you can also see it on this side. See that? As long as the shoulders are level. But now I want to make sure I've got the front to back. So if I've got this centered here on his humerus, and his body is perpendicular to the IR, then I'm going to assume that this is centered. You can also see by putting it here on the line. Okay, so we don't need to have a whole lot of collimation. So now what I'm going to do is just have him pick his arm up and bring it up and over.
Oh,
So the line
cool.
should end up right at the mid-coronal plane there. You see it? I know it looks like odd from this side, but then back up. See how it's centered right on the crosshairs? So as long as you put the part right here on the crosshairs, you know you're going to have it centered to your film. It just throws you off because when you put the arm across, all you're shooting at is thorax here. So
This
you
one
have
has the
to
breathing
trust
stuff.
that you're putting the part on the crosshairs. And then just turn your collimator on and have him reach his other arm up and over. And then what do we do as far as technique with this? What's different than the other?
Oh, you bump up to
Well, but specifically, well, yeah, from the AP to the lateral, we go up 4 times, but what else?
Breathing?
Breathing, right. So we need to increase the time and decrease the MA if that's possible.
Blur out the ribs.
5 seconds?
Blur out the rib. And what it does is it blurs out these ribs, because if these are breathing, the motion will cause this to be, because this isn't moving, it's just this side that's moving. It causes it to be, causes this to be in better focus. Okay? Okay.
What was the center? SBT and
What was what?
deltoid?
Right below the deltoid. So, you know, like, see where my sleeve is? Check it out. Deltoid?
Check it out.
That's what Pilates did for me.
There's already been set down.
Okay. Like we are in this section, you want to move the table down. When we're working in the lower part of the body, you want to move the table up, and I'm going to show you why. So watch out, because I'm going to bring the tube up.
No more bucky.
Okay, so you get this all centered, and you're getting ready to do your shoulder, and you get this. And then you grab your bucky, and you're like,
Oh!
okay, and then you're going to go. It won't, I can't, it won't, right? You're going to have like in the headlights, look. You're laughing because you know I'm right. Yeah, exactly. Seen it 100 times. So just make sure that if you're going to put your bucky up as far as it will go, get the collimator close to the cassette, and then you can move the table. Okay? But if you think about starting off with the table down, then you're not having that extra step of getting all confused. Okay. See if I can. You guys are trying to trick me, huh? You I probably would have. Okay, and then I need the left. I mean the right. The right marker behind you.
It already has
Yeah.
tape on it, yeah. Thank you.
Because I'm not going to see the light, I'm going to put the blocker on the bottom. If you think about the anatomy, the shoulder's going to go across here, the clavicle, the humeral head, the humerus is going to go down here. It's less likely I'm going to get it in the shoulder joint if I put it down. Now I know you all with the DNR, you have to figure out where to put it, like on the body or on the tabletop, because you don't have a cassette anymore. But I'm old school, I've never really done many digitals except chest x-rays, so I'm going to show you the way with cassettes. You can figure out the digital at the clinic.
You go to Alaska.
Okay, so that's 10 by 12. All right, so again, you can see where her clavicle is. I'm going to have, this is her mid-sagittal plane, so I just want the light just slightly to the medial side of the MSP. Can we take this off for a minute? Yeah. Cool. That bulky stuff is hard to. Okay, so just have her relax her shoulder down. So here's the clavicle. So see how as I put 3 fingers down. Notice women have breasts, so it's going to throw you off a little bit in your centering, and don't be palpating too much. Yeah, watch your hands over there, young man. So your clavicle's a pretty safe place for most people to palpate. Okay, so just put your finger on the clavicle and then imagine that the line's going to go. But don't come in from this side, and be careful about all that. Okay, so I have all the center. Now what do I need to do? Arm?
Arm.
Forget the arm. So I'm going to have her externally rotate her hand out, and then we'll internally rotate her hand in, pinky up. Okay, and then neutral rotation would just be at her side, or maybe she'll be laying like this because she's injured. Okay. The other thing you want to look at, see where her face is, and chin and all that.
Mm-hmm.
You want to turn her head away. 1 for radiation protection, and 2 because you don't need the face in the light. This is like more than 12 inches. Oh. Well, I've collimate on her because she's not that big. Okay. Now, the one more thing I need to take care of here.
Should be here.
Yeah, well, see, what I want to show you, you could see it better with Jop, is here is her humeral head. So sometimes you'll see soft tissue coming out here, but we don't really have to image that. We're looking at the humerus. So in some people, you'll see something almost like this, but as long as you have the humeral head, the round part here, you've got the humerus. Yeah, because some people are going to have either muscle or fat, and their arms are going to be a lot thicker. They're not going to you're not going to see the bone so much.
So we have your humeral here.
Yeah, I mean, this would be close. I would prefer that. But what I'm saying is you might see this, and that's acceptable.
Okay.
All right, what else is wrong with this picture?
Marker?
No, marker.
No more?
I could also, if you are going to do a marker tabletop, you could put it here.
What's the picture?
Her face?
What is
We
it?
did that. Some of you made that mistake today with your chest x-rays. Yeah, we are.
Okay.
The pillow!
Oh.
Look it, this is going to cause an artifact. You want to get the pillow out of the way. Some of you did that today with your chest x-rays.
Who
Gave them a
did?
nice soft pillow all the way down, halfway down their chest. Aren't they comfy? Now you got to repeat it because you got pillow artifact. Okay, hand me the body sponge, the 45 degree, please.
Behind you, right there.
Okay. Now, when we do rotations, when you're on the table, we want to use the sponges because it's more comfortable for the patient. As you'll find if you practice with each other, if you're trying to hold yourself up in a 45, it's really hard. It puts a lot of stress on your lower back and everything. But when you go to turn them, first of all, there's 2 angles here. This is 45. This is 30. This is 45 here. This is 30 here. So it depends on how you put the sponge. And also how far you put it. So if she rolls up to her right side, if I put it way in close to her other side and then roll her back, see how she's going to be more than 45 degrees? Mm-hmm. If I pull her up and then put the sponge here, she's going to be less than 45 degrees.
Oh.
So it really matters. You can't just plop a sponge there and expect it to be 45. So you're going to put it like it's right up. And I notice with women, too, you have to put the sponge at an angle. Because if you try to put it straight, there's always this stuff in the back that gets in the way.
What stuff?
The junk in the trunk.
The trunk in the trunk.
Okay.
I thought you were talking about a belt.
No. I mean, everybody has
Great.
it. Some people, women tend to have it more than men, so you have to just put the sponge at an angle. Now, notice, see if you drew a line right here from her shoulder blades to the table, you had a 45-degree angle. You see it? I love it when we get to the... I should make you guys position when we do this scapula next week. Oh. That feels so good.
You'll be talking about position.
I know. No, a little bit to the left. Okay, so the other thing we have to do, we're doing the glenoid fossa now. So I'm palpating the humeral head. I'm going to center over the glenoid fossa, collimate down. And then if she can tolerate it, if we bring her arm out, see that? That opens up the joint space. So notice it's just a little, it's like a 6x6 collimation here. I would change my cassette out and use an 8x10. In the hospitals, you don't have 8x10s, right? You have 10x12s, or those of you that have cassettes have 10x12s and 11x14s. Some of you don't even have cassettes. That doesn't mean you can get away doing this and shuttering it. I better not find out you're shuttering. Like, wow.
That's how you do it.
No. Well, it's actually square.
Oh, but I mean, the cassette, how would you put it in?
Either way,
Lengthwise?
lengthwise, crosswise.
Okay.
And when you see the films, you'll see sometimes they're this way, sometimes because actually the collimation's square, so it doesn't really matter. Okay, now we're going to do one more. What's left? Yes, transthoracic.
Underneath the.
Let me have that small pad. Either one, yeah.